right, well, we are here today at Kennesaw State University with two of our GAHPERD friends. And I'm just going to ask both of them to just give a brief introduction of themselves and really how they got to this point in their journey of being so interested in skills-based health instruction. So y'all can go in either order.
You go ahead.
All right, I'll go first. Hi, I'm Kandice Porter. I'm chair of the Department of Health Promotion and Physical Education here at KSU. And I was previously the program coordinator for our HPE major. And about 5-6 years ago, there was a lot of national focus on skills-based health education, but not a ton of resources. So we were kind of early adopters and very supportive of the idea, but there wasn't a lot of substance to reinforce this with our future professionals. So every time Shape America did any kind of training session or workshop, I would go and get it and attend, and I hopefully got Monica excited about it as well. And so we've just been, we really think we've really seen the benefit for our students on the change to a skills-based approach.
Now, I'm going to inject before Monica gives us her intro. When you have taught previously the old way of teaching health, that's what I'll call it, the old school way, definitions and questions at the end of the chapter. Have you noticed a spark in your program here at KSU with your student teachers being introduced to skills-based instruction rather than the old way? Have you seen a change in their interest in pursuing that more?
I think it does require a shift in the mindset, because when they come to us at KSU, they've never been exposed to a skills-based approach. They didn't get it. This is not how they were taught health. And so it does take a minute for them to shift to kind of this idea of teaching skills and not content. But it does resonate with them because they're health and PE majors. And so they understand that the skill pedagogy piece in physical education, and they are excited that going into the health classroom doesn't mean that they just have to lecture in PowerPoint all the time, that they're much more comfortable with this idea of facilitating student learning and helping them develop skills than that they necessarily have to be experts on every health subject there is, and they're imparting that knowledge on students.
Awesome. Now, Monica, here at KSU, you also work with the majors?
Yes,
prior
I do.
to them going out. So tell us a little bit about yourself.
So prior to coming to KSU, I'm finishing my 8th year here. I taught high school for 3 years. I taught health in a Cobb County high school. Looking back, we didn't call it skills-based health education. And so when I think about my years of teaching high school, it was always very interactive. It was always very student-centered, but it was probably more content-focused, but still very interactive and not working through the steps of the skill like we do, and we teach our students to do that now. So probably, for the last 2 or 3 years, I've been working more with our teacher education students, and, getting the opportunity to help them in the classroom work through the steps of the skill. And as Candace said, they're coming from a place where they didn't experience health education that way. So it is somewhat new to them, but when they get out into the schools and they see it and they see how much the students love it, and how engaged they are and how interactive it is, then immediately, they love it because they get to see how much the students love it, and that's the payoff for it. So.
Well, I think one of the greatest things about being an educator is those aha moments anyway, and how often does that ever happen on the university level? Because, they've been there and done that with everything.
Right.
So that's great.
I'll just add that sometimes, not so much in the last few years, but when we first were trying this, we would have students who really were resistant to this idea. And so we would let them go out, and in our field experience, it's just a 90-minute block, and we would let them try to lecture for 90 minutes and quickly realize that that does not work. It makes easy planning because all you have to do is create a PowerPoint, but it is not effective instruction, and they lose student interest. And so we let them kind of crash and burn, and then they come back and they're open to the idea of doing something differently.
I love that.
And we celebrate with them when there was like one specific time I remember it happening, and we debriefed with the students after they taught their lesson. And they're like, I am not going to talk that much next time. And I think we were like jumping up and down in the hallway.
Yes.
We were so excited. But it's the aha moment. It's like they have to figure it out and do it themselves.
But that block schedule, I mean, and that's, been around now for 20 plus years, I guess, but it lends itself so well to skills-based, both in physical education and in health.
Yeah.
So this has been a unique year for all of us as educators and for those who are watching. Do you feel like that it has changed the importance, kind of moved it up the pedestal a little bit, health instruction this year because of the pandemic?
I feel like it should. I think right now we see there's been no time where we see a greater need.
Right.
From one aspect of just understanding the pandemic, but I think a lot of what we see already and what we will see coming from this are kind of the web of other issues and concerns, whether it's mental and emotional health, isolation, lack of physical activity, digital wellness, just becoming more familiar with what it's like to be on a screen for that long. So I think there's a lot of other concerns that we're starting to see as the research is coming out, but I think we'll continue to see this in coming out. And this just shows the need that we really need quality health education in our schools for our students.
Well, and hopefully we'll never be in this era again. Please, Lord, let this pass. But when you talk about that term, and that's a new one for me, digital wellness, what did that do to skills-based instruction with the digital screen format of trying to teach virtually? Did y'all have to drop back and regroup and rethink, or what happened with it? Is it possible to do it?
No, I think we definitely, probably like everybody else, had to step back and rethink how we were gonna do that. I think specifically for us, it was, since we're working with the teacher education, the pre-service teachers, it was then teaching them all of the new ways to teach the students in the schools.
Right.
When we could get into, sometimes we couldn't even get into the schools.
Right.
So when we had the opportunity to be in the schools, it was helping our pre-service teachers come up with ways. And my suggestion then was find ways to engage, because they had students in the classroom and they had students who were online, and they would come back and say, I don't know how to engage all the students. And so my suggestion to them was to always try to come up with new forms of engagement, because whatever they could do to engage the students who were in the classroom and who were online and trying to do both, those forms of engagement will work going forward, right? So if it continues to be a blended classroom, then they'll know how to do that. If it's all the students just in the classroom, either way, they've got to get creative with the ways to get them involved.
They have an arsenal of tools that they never had before, and never probably would have developed in our program, at least, had this not happened. So I think they're better equipped to teach moving forward. And I also would say that the COVID-19 pandemic showed really why a content-based approach to health education is not effective. None of us could anticipate the past year. And any curriculum that's focused on addressing content is going to be immediately outdated. We just can't anticipate what the new health crisis will be, or what the new risky health behavior young people will engage in. Remember the Tide Pod challenge? So yeah, as teachers, we can't stay attuned that much, and our curriculum, if it's all content based, it's going to become outdated quickly. Whereas skills they span the life of the, can I pause?
Yes.
Yeah. So So a curriculum that's focused entirely on content is going to get quickly outdated. So if we are addressing skills, and they will serve the student well while they're in high school and beyond, and it helps them to navigate the issues that we're trying to address with health literacy. So they know how to access information, so something new come out. They know how to analyze their influences. They can communicate effectively. They can set goals to protect themselves in the latest health crisis, and they can practice those healthy behaviors. So those skills are for a lifetime versus content that's going to quickly become obsolete.
And the two of you probably know a lot more about this than I do, but, you know, as far as, let's just think about the publication of a health textbook and the time process that goes from the author's pen to publication is months, years, whatever. I mean, I know we're faster now than it used to be, but what are you seeing in the schools? Are you seeing health curriculum that's tied to a textbook and following that way, or are they moving away from using a textbook and just going more curriculum based? What do y'all see out there? First off, I have to say that your teachers that your students work with have to be learning as much or more as your students too. So they're learning new ways to teach, which I think is awesome.
Yeah.
But what are you seeing in the schools?
Well, I mean, certainly we have actually had some people approach us and say the timing is perfect. There's the new GSEs and we're up for textbook adoption. I think you can move to a skills-based approach and not have a textbook. But I know that's a big leap for a lot of school districts. There are textbooks out there that have more of a skill focus than others. They try to incorporate the skills cues and the models within them. We're not affiliated with any of them, but I would recommend that a school district look at something like that rather than one that's entirely content based, because you're right. By the time they get published, they're already starting to look dated, and certainly within 5 to 7 years, they're going to be completely obsolete, and that's not how quickly our school systems adopt new textbooks generally.
Well, I know with my own students, I'm just curious, as with yours, when they go out to the field from KSU, do they come back with a teacher edition and say, this is what I'm supposed to teach from?
Yes.
When they're generating their plans? I guess that's what I'm looking for. So their teachers saying, here, teach from this.
Yes, we'll get a Friday where, like that's generally they get a 90-minute block and they're told to teach a chapter, right? Which is so much content. So then they get so concerned that if we're trying to promote skills and do what we're requiring of them, they can't do it all.
Can't cover the chapter.
Yes, you can't cover the chapter, and then we have to have that deep conversation with them about what are the key takeaways you want students to have. Is it memorizing a bunch of facts, or is it you want them to be able to apply this in their real lives? And so it takes a moment for students to realize that they can go through that chapter, identify the functional health information that students are going to need to know in order to perform the skill, and then take the bulk of their time to work through the skill pedagogy piece and have them practice the skill and then assess it and give feedback.
Monica, do you have teachers come to you and say thank you for sending me these students because I'm learning, or?
I think we're starting to see more of that. I think it's been a process to get, to get to this point with skills-based. I think, for some teachers, it's a big shift to think about making this change.
And let's don't leave out all those years of lesson plans
they've
done that they do not want to edit and revise.
Exactly, exactly. And some of our teachers will go into their student teaching experience, and because their cooperating teachers have all of this, they'll kind of walk in, and those teachers want them to use that because they've been teaching that way, and that's how they've done it. So I think, it is still going to be a process, which we're very excited about because we're passionate about it, and we want to see this shift happen in the schools. We see that the students really enjoy it, and we see the benefit of it, and so I think that's important for us in working with our students, but then also if we can help other school districts in and implementing all of this, I think that that's really going to be important, because that's where it's going to happen, is, you know, the teachers in the classroom. The GSEs are there, but it's actually, you know, implementing these with those methods and those strategies that's going to be important.
Well, and Candace and I discussed prior to the interview that y'all have already got plans to work with some of our local metro school districts, which I think is awesome. And I just want to put a plug in, because y'all have promised you're going to present at Georgia AHPERD in September. So we're hoping that if this sparks an interest in our teachers, especially, that they'll seek out those sessions to come in and listen and learn. And we also hope to have some things there with Trace, with the new standards, and also with our directors. So hopefully y'all can see them face to face. I know you've Zoomed with them, but I think just having y'all in the room with them could even build more excitement for those teachers.
Yeah.
And if our teachers go to their coordinators and say, hey, we want these people to come into our school districts, that would just be a win-win for everybody. So
Yeah, I think that's why we're so passionate about doing like the professional development piece, because the more our students see this in the schools, the more they come to us prepared and ready to be, use a skills-based approach as future educators. And then the more we do professional development, the more we have great field experiences for them to go out to. So that I think that's one of our major concerns, is that we do all this and then they go back into a school system where they're told that they have these student learning outcomes that they have to address, and they're all content based, and then they kind of fall back into habits that we know are less effective than a skills-based approach. So I think that's one of the reasons why we are just willing to work with anybody that wants assistance in moving in this direction, because it is new, it's different, but I think that once you get accustomed to it, it's a lot easier. It's easier teaching, because students are engaged and excited about the process, rather than just kind of sitting there and getting it.
Right, you're not having to do the dog and pony show in front of them to entertain them. So, I don't know that this works, but I always try shaming my physical education students. Do not be one who goes out to roll out the ball.
Yeah.
And to me, with this in the health classroom, it's kind of the same thing, because you don't want them to just roll it out the easy way, the way that they were taught, and that is something. Do you do anything special to like say, hey, I know you've got this, and I know you've seen that. How do you motivate them to like, okay, promise me, raise your right hand and take a vow? What do you do?
Actually, we did do a commitment this past semester. We did a commitment ceremony, and it was the week before they went out, and we actually got ring pops for them, and they had to commit to being their own person and their own teacher, and developing their own teaching style, and not falling into whatever else they might see happening in the school. So we actually did do a commitment ceremony. It was fun. It was good.
Okay, so we've kind of already answered this question, but I'm going to ask it just, to overkill it, because I want our listeners to know that the outstanding characteristics or qualities that you feel are a part of a quality, I've used quality several times in there, but what makes a good health program?
Well, a lot of things really, but I think when we're looking specifically at skills-based health, giving the students an opportunity to learn the skills, and to build and to practice, right? Just so like when we see in PE, I think it might be easier for health and PE teachers to understand this if you can compare it to a PE model, where you go in and you explain the skill, right, and explain the importance of the skill, you model that skill, and then you give them an opportunity to practice. And so it looks the same in the health classroom. So really having an opportunity for them to see the skill, what it looks like, and then to be able to practice that. I think with that, giving them an opportunity to build on that skill, you've got to make it a meaningful and a relevant experience for them. And so it's got to be something they can connect with, right? Because if it doesn't really mean anything to them, they're not going to care that they're practicing that skill, and they're not going to see where it would be important outside of the classroom, because ultimately that's what we want them to be able to do. It's one thing if they can do it in the classroom, but we want them to feel confident enough that they've had the time to practice it, they understand it, and so when they have that opportunity in real life to do it, they can do it. So I think somehow creating an authentic experience in the classroom too is really important for that. And the teachers, having qualified and trained teachers to be able to teach them, that's huge.
And that's the thing right there that I'm seeing more and more of, and I don't know if y'all have experienced it here, but people gazing into our field. And we have athletes walking all over this campus and up and down streets in Georgia that understand sports, and obviously we have students with a science background who understand, a little bit more about health education than the average person, but not having the skills as a teacher to impart that knowledge, to teach our kids how to teach, I think is becoming more and more widespread in school. And I don't know how to educate the administration into, because I thought the pandemic might do it. The pandemic, okay, obviously we do not understand disease transmission, we don't understand the whole germophobia thing,
Right.
Here, let's have a recall on, we put health educators in a health classroom. Are y'all seeing a shift at all in that? I've seen it go downhill instead of.
You want to share your story about your own son?
I think Kim even knows that story, where there were teachers who were definitely outside of the discipline who were teaching health, and I reached out to the school, and this was in the fall. This was the return to school, where they were the middle school students were home. They were learning from home, and again, what better opportunity to teach health to incoming middle schoolers, in the middle, they lost the end of their 5th grade year. They've been home, for 4 or 5 months at that point. And then you've got 3 different teachers outside of the discipline who are teaching. For a health educator and someone who trains future health educators, that burns down here for sure. To me, it was just a missed opportunity, and I think going back to one of the first questions we talked about is, did this pandemic change anything? Did it create awareness? This has got to be a time that we can do more, right? This to me is a perfect opportunity to advocate for more health education. Quality health education by quality and trained professionals who, unfortunately, I don't think we would see the same in math.
Right.
Or reading, we wouldn't.
I think it's time to seize that moment too,
Yeah.
and I don't really know how to go about it other than things like this.
Yeah.
To have teachers speaking up for teachers, but our administration across the state have got to get on board with this. And I'm a coach. I coach for many years, but you're not paid to do that during the day, and for them to put someone into that spot who feels a coaching need and can read a textbook, we're losing our kids.
Right.
And that's why I think having some frameworks from the state will be helpful, because a skills-based approach is very different than someone who just picks up a textbook and starts reading from it or teaching from it. I think that's where you're going to see the big difference between a highly qualified health educator and anyone else, is that they embrace kind of that experiential learning and more of a skill-building approach than just disseminating information.
Yeah, I almost feel like we need to have y'all speak to an administration audience, a principals group, especially now. I just feel like we got to seize the moment.
Advocacy is so important.
Yeah.
Very important. Okay, so health literacy, as defined, is the ability to access, understand, appraise, apply, and advocate for health information and services in order to maintain or enhance one's own health and the health of others. That is the basis for measuring our health education programs in Georgia. how does this push us towards skills-based instruction if we're going for health literacy?
You want me to
Is it
start?
possible
Yeah,
then
go ahead.
without content, with content-based, is it possible to be a health literate person following the old model?
I would argue that no, that you're not going to develop health literacy by focusing primarily on content. If you think about like the health education standards is kind of a hierarchy, kind of similar to what you would see with Maslow's. Content is the very bottom. It's the basis for behavior change. It's a precursor for behavior change. But what you need is that ability to practice skills. And so standards 2 and 3, analyzing influences and accessing information, that's a little more health literacy oriented. That's foundational. And once they build those skills, they can start to communicate effectively. They can start setting goals. They can implement those plans by practicing healthy behavior. And then ultimately, now that they've addressed their own personal health and wellness, they can be an advocate for their fellow classmates, their schools, and their communities. So by just focusing on the lowest level in content, we're never going to build those skills that are needed for them to really be health literate individuals. And that's what we've seen. I mean, I don't think that the lack of health literacy in our country is entirely health educators' fault. But at the same time, the health programs that they went through the K-12 education system did not address health literacy in an adequate way. And so it's not a surprise that we have situations where, as many adults in this country cannot make a health-related decision based on good data.
Great answer. Want to add anything to
It was a great answer. Sorry. We'll have to cut that part out. No, I think, that's the perfect description of it. I think this, in looking at that hierarchy, I think it brings it all together in what we want to see in a health education classroom, because ultimately that's what we want we want our students to be health literate. We know that is a predictor of their health outcomes if they can work through having those skills and having that knowledge. That to me, it's putting all the puzzle piece together. You've got that base foundational knowledge piece. You've got to be able to perform the skills, but then I think the other thing is that it's got to be addressing their attitudes and the values and the beliefs, because they have to want to do it, right? So we can see our students and we can teach them all the information that they need. We can give them opportunities to practice that skill, but how can we also help them shift their attitude so that they understand that ultimately their choices do impact their health? And so, I think that kind of brings it all together, and that's what skills-based health education can do.
Mm-hmm.
Well, I know that you know this from being a former public school, especially high school teacher, because I had this, I put this on myself, this pressure almost, that I felt like I was the last stand. I was the last chance that these kids had before going out into the world to practice or not practice healthy behaviors in some pretty heavy topics. And so I know you understand that because you taught high school health. So is a transformation possible for a teacher to do on their own from a content-based type of teaching into skills-based, or do they need y'all? Do they need specific instruction or to seek out resources online, or just what kind of professional development, or does it take professional development or just a desire to do it? How is it possible? How is that transformation possible?
Do you mean for the teachers?
Yes.
For the teachers themselves?
To change their program from the old to bring it into 2021.
I think all of the above.
Mm-hmm.
I think you have to want to do it, right? So it's just like our students. We can tell them, teach them the healthy behaviors, but if they don't want to do it, so that's that shift. So I think you have to want to do it, and hopefully you see the benefit of it. But there are tons of resources out there. The other shift that I think is really important is that for so long we've had to think of ourselves as health educators as content specialists, right? We have to be so familiar with all the drugs and the chemicals in cigarettes and mental health disorders and signs and symptoms, right? But I think that we have to, the shift also, we need to think about becoming experts in the skill and the skill pedagogy and how to teach the skill. Again, I'm going to compare it to, or liken it to physical education, where we go through that process and we break down the skill and we use skill cues. We do the same thing in skills-based health. So that the students will understand what the skill is. And so I think for a teacher who's going to start learning more about skills-based, what they are going to do is they're going to teach those skills, and they have to shift to thinking about, what does the decision-making model look like? How do I teach this? You can teach it using a number of different content areas in functional health information. So you might teach them decision-making with alcohol, tobacco, and drugs, or you might teach it with healthy eating. So the content area can change, but where a teacher really should spend some time in preparing is in how to teach that skill. What does that skill actually look like? What are the cues to that skill? What are the steps look like? What activities can I do in my classroom so that my students will understand the skill?
Okay, so my next question was words of wisdom, and obviously that's it right there, is to become familiar with that. So can you all give us a sample of like whatever content area you would like to choose, of maybe a comparison in the old way, content-based, it would have been taught here like this, but in skills-based health instruction, it would look like this. Can y'all just give us a snippet of something? I'm not asking you to teach an hour-long lesson, but just some examples maybe, so to clarify for our listeners, they'll understand what we're talking about. It won't just be terms.
Well, I think like one example that we oftentimes use is mental and emotional health. And first, I think we need to take a health positive approach, because so many times we talk about health disorders, or we talk about disease, and health is so much more than the absence of disease. So when you're talking about mental and emotional health, if you look at a lot of the units and things that are out there, they tend to focus on mental health issues and disorders. So like let's start from a place of positivity, and like, what do you need to be mentally and emotionally healthy? And so identifying those areas, kind of determining what's the functional health information that students are going to need to know in order to perform a skill. So if we partnered mental and emotional health with like analyzing influences, you would need to know what the skill cues are for analyzing influences. What's the skill model look like? I mean, there's a few authors that have different models. We tend to use one that's available from Sarah Benes and Holly. And Holly Alpert. They have two or three great books out there now. I think they just got a new book out, and which is available through Shape America. And so they have a 5-step model that's the one we use to teach our students. And I think that's the one thing about skills-based that we really haven't talked about, is that it's actually, when you get to it, it's a lot less information and things to be doing in a curriculum. Like right now, when you're trying to do all the standards in every content area, there's never enough time to do any of that, right? So now you're just taking one content area, drilling down to what is the most important information to know about that content area to make to be healthy, and then teaching it within the context of one skill. And when you start that, you would just first kind of set the groundwork, right? Why is it important that you be able to analyze influences? What does that mean? What's an internal versus an external influence? Things of that nature. Just kind of letting students know why this is an important skill for them to develop. And then the next step would be kind of walking them through that model. Like, what is it mean to analyze your influences? What's the first thing you need to do before kind of acting on a choice? And then moving through that. And then the third step would be kind of modeling it. What does it look like? What does it sound like? What does it feel like to go through that process? And having the teacher kind of facilitate that, or as a whole group activity, rather than letting students break and do it on their own for the first time, so that they know what it looks like when it's done well, and what it looks like when perhaps there was some imperfections, or it didn't work out as well as you would have hoped. And then lots and lots of authentic opportunities to practice. Some starting from pretty structured to moving forward with allowing students to have some input. Maybe if you're doing something, a case study or a role play, where students actually kind of create that script or do the research to support the case study, so that they have more buy-in. And it's, although I remember thinking that I would never be too old to be able to identify with high school students, they know, yeah, that time has long gone. They can come up with something that's really authentic and real for them, right? And then, of course, always providing feedback and reinforcement when things are working well, and so that they know that they've got opportunities to practice, and they're going to get feedback on whether, where they are in that skill development, because you really want to move from proficiency to mastery, so that it sticks with them, so that when they're out in that real world situation and they have to make a decision or do a refusal skill or set a goal, they're doing it, and they're doing it well. And so it's just innate and indoctrinated at that point, that it's not like on the spur of the moment, I've got to figure out how to handle this particular crisis.
So
I just went through that so fast, Monica.
No,
I know you're probably like, wait.
No.
I'm just, for clarification's sake, you're not looking at a curriculum that says, okay, from August 1st until August 31st, we'll be covering a unit on hygiene. And then September 1 to September 30th, we'll cover a unit on skills-based instruction. Is going to be skills in those slots rather than topical indexes from a health book, correct?
Yes, for the most
Even
part.
though you're going to cover some of those
Yes.
things, but the skills take the forefront.
The skills take the forefront. I mean, in the frameworks that we've kind of been thinking about and presented to various folks, we feel like if you completely eliminate the content, it makes people feel very disoriented.
Nervous.
Yes. And there's a lot of content still in the GSEs, so we need to make sure we're addressing that. So what we do is we partner a content area with a skill, so that you have 7 units of instruction. You have, those are the skill standards 2 through 8.
Mm-hmm.
And then they're at each grade level, they're married to a different content area.
Okay.
And sometimes they happen multiple times, and then sometimes they may not be addressed, like effective communication. That may not be essential when you're talking about nutrition, but you really want to hone in on goal setting and practicing healthy behaviors.
Great.
I think the other thing to kind of finish out what it would look like in a lesson or a unit is that the assessment is going to look different too.
Mm-hmm.
So it's doing away with the idea of multiple choice tests, because that will assess the content knowledge.
Right.
But we're looking to do authentic assignments in projects, and so maybe it's a role play situation, maybe it is a debate, maybe it is a home journal that they had to do. If you're looking at standard 7, which is practicing health enhancing behaviors, maybe they need to journal for a week or 2 about something that they did at home. And so assessment definitely looks different for skills-based health.
And it takes more time to grade, but it's well worth it,
does.
right? Or, I would say too, to the listeners, maybe your students have a menu to select from, which even serves to increase their enthusiasm about the assessment more, that they can put it into an area that they have interest in. Some of our students are much more creative than others. And so that's great. I'm so glad you put that in there.
Yeah.
Now, is there anything else that you would throw in, like these teachers really need to know? Why should they come and see you at the convention? Why should they be in your session? What are they going to pick up there?
I can't stress enough that for me, going to the workshops that I've been to over the last few years has been such a game changer. just like our students, I learn through hands-on. And so being in a workshop type environment where I get the chance to actually see what it looks like and hear it and see some sample assessments, for me, that really helped me. And so what we hope to do with these workshops is deliver the same, that I think teachers often feel like they do have to cover all of the content area and all of the skills in one unit. And if we can help break that down a little bit and get a better understanding of how to pair up a skill with a content area, I'm hoping that will help clarify some. And then again, I can't stress enough just understanding what the skill is. What does that look like in your classroom? How do you teach that? And you know, that's where, again, the teachers are going to have to do their homework for that. Again, there are a ton of great resources out there. We'll share those at the workshop as well. And some of these resources, I mean, they have lesson plans and extension activities and modifications and sample assessments. I mean, there's so many great resources out there too. So I think.
Well, y'all are our great resource. So thank you so much for today and for giving up a summer afternoon to try to let our members learn a little bit more about skills-based instruction. Thank you for your expertise and your willingness to do it today.
Yeah, thank you. We're excited to share it.